Good morning. My name is Okira Harris. I serve as the Assistant to the Director of Public Engagement at the Office of the 75th Governor of North Carolina, Governor Roy Cooper. This is our 13th webcast, and today we will focus on unpacking important changes regarding North Carolina's stay-at-home order and reopening schools. To stay informed about this transition, we encourage you to visit the COVID-19.ncdhhs.gov website. During this session, we also encourage you to engage with us via the YouTube and WebEx chat rooms, where you can submit questions real time. Today, we will hear from Director Jeremy Collins from the Office of Public Engagement and Mr. Quinn Godwin, Central Regional Field Coordinator from the Office of Public Engagement. We also encourage you to visit the North Carolina Department of Health and Human Services website at ncdhhs.gov/coronavirus. With that said, I invite Director Jeremy Collins to the stage.
Good morning. My name is Jeremy Collins. On behalf of Governor Cooper, Office of Public Engagement, and the state employees and staff across the cabinet and the state of North Carolina, thank you for being here with us this morning. Here we are again with an increasingly deadly virus that is continuing to plague our North Carolina community and compelling us to make decisions to keep our students, teachers, families, businesses, and communities safe. I'm going to first start with kind of a COVID update and move into a broader community and volunteerism update. As of today, we have 91,266 lab confirmed cases. 1,782 new cases reported as of today. 1,142 people are hospitalized due to COVID-19, and sadly, 1,568 people have died. As always, we send our sincere condolences, our thoughts, our prayers, and our hearts go out to families who are dealing with the loss of loved ones because of COVID, but also the recovery from COVID is not easy as well. So there are many folks in our communities who dodged the fatality, but are still living with the terrible consequences of COVID exposure. And so our thoughts and our prayers go out to those families as well. The reality is this disease continues to spread. And so other than limiting your interactions with persons outside of your immediate family and home, the best thing that we can continue to do is to practice the 3 W's, to wait 6 feet apart, to wear a face covering, to wash our hands frequently. These things work. The science tell us, despite the rhetoric, despite the conjecture, those 3 things, particularly the face covering, is helpful. And so we'd ask that you do that to keep not only yourself, but your neighbors very safe. Right now, in contrast to what's happening around the country, North Carolina does have the capacity to handle COVID-19 exposures. We do have our hospital beds and ventilators, but the way that we can keep that is, again, to protect ourselves and to protect our neighbors. The governor on Tuesday announced, in addition to a number of things, 2 key updates. The first is that we would essentially be staying in phase 2 for an additional 3 weeks. And so where phase 2 was supposed to end on 17 July, tomorrow, it has been extended out to Friday, August 7th. And so that safer at home phase 2 is now extended out to August the 7th. The other that much anticipated announcement was the Plan B school option. And I'll give you a number of key provisions, but I'll remind you that Plan B is not just that schools will be open. It is schools will be open and parents have the option for virtual learning. And so I know there's a number of folks who are saying, I can't believe the governor opened the schools. I can't believe that we are given that guidance. What we've actually done is open the schools and allow districts to come up with plans that best fit their students and their families and their communities' needs, but also left open, left available the distance learning option, the remote learning option. And we understand there's an equity concern there because not every student will be able to have access to broadband. Not every student will be able to have access to high-speed internet. And even in that setting, there are some rural settings where not every student can rely on getting the paper documentation from their classroom to get that work done. And we're going to work as hard as we can with our Department of Public Instruction, the Department of Health and Human Service, and our state officials to make sure that not only can every student maintain kind of the learning process through this, but that they're able to access and achieve in an equitable way. And that goes from receiving the materials all the way to getting the best quality connectivity to broadband and high-speed access and the devices that are necessary to do the work. So the schools will open, at this point, schools will open in the fall for the Plan B option. It's a measured approach. We are asking local districts to come up with the best plan for their communities. And to remind you all that it's not just schools being open, it's the schools are open, but also parents have the opportunity for remote learning. We want you to know that this was in consultation with our local communities. We listened to students and parents, and we listened to the local school districts, and we wanted to have a measured and even-handed approach to allow our students to the best opportunities to learn while also honoring the necessity of having a setting where most folks can do their very best in the academic setting. Face coverings will be required for every teacher, staff, and student from kindergarten through high school. As I said earlier, the studies have shown that this is the best way to reduce the transmission of the virus. To help with that effort, it's not going to be an unfunded mandate. We are providing 5 reusable face coverings for every student, teacher, and staff member. We've already delivered a 2-month supply of thermometers and medical-grade equipment for all school nurses. Schools will be required to limit the total number of people in the building so that 6 feet of distancing is possible. Districts and schools can use this plan that works for them, whether it's alternating days or alternating weeks. This won't be a kind of one-size-fits-all type approach. Schools must create a way to isolate students who have symptoms and ensure they can get home safely. Schedules must allow for frequent hand washing and regularly cleansing classrooms, bathrooms, buses, and equipment. Teachers will need to work to limit sharing of personal items in classrooms. So much of this, and we want to acknowledge, so much of this is a plan from Raleigh that will affect teachers all across the state. I'm thinking about my own hometown, Martin County, where the teachers already have to do so much in a small, predominantly rural school district in a state where you've got to buy your own supplies and you've got to take care of your planning and you've got student needs. And we understand that this is heaping yet another thing on the list of duties. And while we praise you all the time for being superheroes, supermen, and superwomen, it does come at a price. And so we want to acknowledge that this is an additional step for students and parents, kids. We're asking our kids to step up. My daughter now is a mask police officer. She wants to make sure that people have got their mask on, and she wants to make sure people are socially distancing. I dropped my mask yesterday, and she said, "Dad," no, she thought I dropped my mask. She said, "Dad, did you drop your mask? Because if you drop your mask, you got to wash it. You can't just put it back on." And so our children are having to mature quite a lot in this moment. And so this plan, while it's thoughtful and even-handed, we do recognize that it does put a lot of onus on the people who are implementing it and the students who have to live in it. Non-essential visitors and activities involving outside organizations will have to be limited in local schools. In addition to those requirements, we are implementing a few more. One-way hallways and entrances, keeping students in small groups that stay together as much as possible. Students eating lunch in the classroom if the cafeteria will not allow for social distancing. and suspending activities that bring together large groups like assemblies. The scientific evidence available shows to us, kind of in support of this plan, that children are less likely to be infected with COVID-19, and the children get less severe illness than adults. More importantly, children who have COVID-19 are less likely to spread it to others, even in school or group settings. As the governor has said from day one, we look to the data to show us the data and the science to inform our decision, and this one is no different. We look to the science to see where we are on COVID-19, and the data included information from children, psychologists, children experiences, parents, local school districts. We try to be as measured and as thoughtful and as all-encompassing as possible. While the emerging evidence shows that schools are at lower risk, we need to reduce the risk for students, teachers, and staff. And the best way to do that, in addition to our robust public health requirements, is to make sure that our school opening implements the 3 W's: to wash our hands frequently, to wear the face covering, and to wait 6 feet apart. This effort to reopen the schools is not going to be an easy one. And we, as the governor announced earlier this week, we may fold into a plan C from plan B. But the emphasis here has to be placed on our keeping our communities safe for everyone, keeping our educational access equitable for everyone. As we move into the broader community, there are a few things that you should know about our volunteerism opportunities. What you have to know is that as more parents decide to move into a virtual learning space, that there's going to be opportunities and desires for more students to get tutoring in a virtual space. If you want to learn how to access much of that or be connected with some of those volunteer and nonprofit organizations, we ask that you visit the governor's volunteerism website. That's volunteernc.org. That website again is volunteernc.org. Many of the volunteer organizations will be offering virtual tutoring. You should also know that most of the organizations that offer that will require some sort of background check, just like in any other case where you'd be working with children. As our renter protections and utilities protections begin to expire, you might imagine that many more community members will need services from, let's say, the food bank or our Goodwill foundations. Please consider volunteering with these organizations. They are the backbone of our communities. As you might imagine, there's so much that government can do, and then there comes a point where there's so much that our respective families can do. And in that chasm is where the faith community, our civic organizations, and our volunteer organizations live. And we want to support them as much as possible. As you hear Caroline Farmer say each week, if you're going to be out, you ought to be volunteering. If you haven't volunteered yet, now's your time. Again, visit our offices, our governor's office of community service and volunteerism at volunteernc.org. As you might also imagine, as we've gone to a remote space, several of our nonprofit organizations have had to let some of their staff go and are looking for remote assistance. Contact the volunteer organization in your community that you're interested in, whether it is the food bank or Meals on Wheels. As you might imagine, when the school year starts, there will be an increased strain. And so if you can help in a virtual space, now's the time to make that effort known. I'll also remind you that as a state employee, if you are a North Carolina state employee, there are opportunities for you to volunteer and receive credit for that in your work time as far as available leave to do that volunteerism. Finally, I'll just say that as we are facing this pandemic and dealing with an issue that we've never encountered before, it's highlighting issues of equity, it's highlighting issues of disparity. And as we're doing that, we're trying to keep ourselves safe and keep our children safe and keep our communities clean. And so I'd ask that we all be nimble with each other. This is a time for us to come together and to continue to work towards solutions. This is something that none of us know a whole lot about. We're learning literally every day, every week, what this is. And so as we're kind of working to make our society safer and more just and more equitable, we also want to make sure that the people who are doing that work and the communities that we're serving are living as the governor desires, as our administration and our team desires, more purposeful, more abundant lives. So as you're wearing as you're practicing the 3 W's, you're wearing the face mask, you're washing your hands, you're waiting 6 feet. Also remember to be a good neighbor, to be a good friend. Realize that those 3 things in some part help you, the individual, but in the most part, they help all of us be better and to be healthier and to lead more abundant lives. On behalf of Governor Cooper, I want to thank you for joining us again today. On behalf of Deputy Secretary Ben Money, on behalf of Director Caroline Farmer, on behalf of Secretary Mandy Cohen and Secretary Eric Hooks, the Governor's Cabinet, and most importantly, all of our state employees, thank you for your partnership. There are ways to stay in touch with us. Our office website is governor.nc.gov. You can also visit nc.gov/COVID-19 for resource information about the schools reopening, about our dashboard for our COVID-19 cases. And we just ask that you stay in touch with us. Thank you for your time.
Hi, everyone. My name is Quinn Godwin. I serve as the Central Regional Field Coordinator in Governor Cooper's Office of Public Engagement. Since his announcement on Tuesday, we've heard from numerous constituents. Just this one side, our engagement team is just one side of our, again, Office of Public Engagement. But the other side is constituent services. And that's where we field questions from all North Carolina constituents. We get them an email. I mean, any mode of communication, we try to field those questions. So we have noticed that there have been some reoccurring issues that have been coming up in our office. So I want to get to that, and I also want to get to the education and schools frequently asked questions, because we're going to field some of the questions that you submitted today on YouTube. So first of all, community issues and constituent services. We are staying in phase 2, just to be brief, due to the continued high case numbers and hospitalizations. North Carolina will remain paused in safer at home phase 2 for 3 more weeks. And of course, that original executive order expires on this Friday, tomorrow, July 17th, but we're going to continue for 3 weeks past that. We're getting a lot of calls about the state bar exam. We do not have any control over this. We advise all people that might be taking the bar exam, they should call the state bar, and we have that number. That's 919-828-4620. And one final thing for constituent services, universities and colleges opening back up. We encourage all constituents to contact the individual university. There is some guidance, and I'll point you to some guidance on universities opening up and colleges. So that brings me to the next point, which is the education and school frequently asked questions. I want to point you in the direction of a web page that has several useful documents. And it's especially helpful for parents because there's a FAQ page about going back to school. So again, Jeremy, reiterated that schools will open for in-person instruction under an updated Plan B that requires face coverings for all K through 12 students, fewer children in the classroom, measures to ensure social distancing for everyone in the building, and other safety protocols. So the first thing I want to show you, this document right here, it's called Strong Schools NC, and it's the Public Health Toolkit for K through 12 for the upcoming school year. How do you get to this page? Okira mentioned earlier that DHS has a specialized page where it breaks out all information into different categories. Whatever you want to know about, education or business in the era of coronavirus, it's on there. And how you get there is it's covid19.ncdhs.gov. And what you want to do is you want to go to that webpage, and like I said, there's a very helpful topics there, all kinds of guidance and data that you need to ensure that your family's safety. When you go to the webpage, the ribbon on the top, select guidance, and under the guidance options, you'll see a selection for education. So under education, you'll see it'll be broken down to schools and colleges and universities. And under schools, you will find 2 documents. And like I said, the Strong Schools North Carolina Public Health Toolkit, which is a 22-page document with appendices, and that basically goes through the whole education plan, what's going to be happening over the next several months. And also under there, you will find Strong Schools NC Public Health Toolkit, K through 12. And those are frequently asked questions. It's about 6 questions of pages, or 6 pages of questions. And what we want to talk to you about today and what we've seen online is we had a question come up on YouTube. Will districts who choose to open schools with Plan C be exempt for the first 5-day mandate from the GA? I believe that from what I've seen, that's not really applicable. I mean, it wouldn't make sense for districts, individual districts who are allowed to choose Plan C to be subject to a 5-day in-person, I guess, sequester for students. So we don't believe that there is any conflict there between our Plan B and the 5-day mandate. Another thing, high-risk school employees. This is very important. Of course, we're concerned for not only the safety of the children, but everybody that works in the building. You're talking about administrators, you're talking about teachers, substitutes, assistant teachers, you name it. And in this frequently asked document, like I said, it's on the covid19.ncdhs.gov website. It talks about high-risk employees. So on there it says, how should North Carolina schools support the health and well-being of students and staff who might be at high risk for severe disease due to COVID-19 as they plan for reopening? Again, this document, the toolkit, you go to page 6, and it shows the statewide requirements and recommendations to keep our employees, our public schools employees safe. Protecting vulnerable populations is critical to support the health and safety of our students, their families, and our staff across North Carolina's public schools. You should connect directly with your school for support as they finalize the plans for returning to school buildings. Remote learning options must be provided for students who are at high risk for severe disease due to COVID-19 or whose family members are at high risk. So individuals who are considered high risk for severe illness due to COVID-19 include people who are 65 years of age or older, have a high-risk condition that includes chronic lung disease or moderate to severe asthma, heart disease with complications, compromised immune systems, severe obesity, body mass index of 40 or higher, and underlying health conditions, particularly if not well controlled, such as diabetes, renal failure, and liver disease. If you are interested in more information on who is at high risk for severe illnesses and what's being done to mitigate that potential risk, please take a look at the links that are available in this frequently asked questions document from the CDC and the North Carolina Department of Health and Human Services. I think that's it for today's questions. In closing, again, thank you for being with us today. Just remember to protect you and your family in this situation. You got to wear a mask. Everybody needs to wear a mask for us to get out of these surge of numbers that we're seeing today. Please remember to adhere to the 3 W's. Wear a mask, wait 6 feet apart, and wash your hands. Of course, we're still on that 20-second washing your hands. I'm constantly washing my hands all day, and then follow up with a little hand sanitizer if it's available. But if everybody adheres to the 3 W's, wear, wait, wash, we'll be able to put a dent in these numbers and help to further lower these positive rates in our districts. So again, thank you. That's it for today, and enjoy your afternoon. Thank you.